Hello everyone. Today's topic of discussion is the differences between the limited and the diffuse type of systemic sclerosis. Now, systemic sclerosis is one of the long cases which might come in your exams, and all dermatology PG students should be well aware of these changes, as this might be a probable question which your examiner might ask you. Otherwise, also you should know what is a limited type of systemic sclerosis and what is a diffuse type of systemic sclerosis. So, if we will be talking about the limited type first. In the limited type of systemic sclerosis, there's a long history of Raynaud's phenomena, and the interval between the onset of the Raynaud's phenomena and the onset of the cutaneous changes is more when compared to the diffuse type. As the name suggests, it has a limited skin involvement, and only peripheral skin involvement is seen in the limited type of cutaneous systemic sclerosis, and otherwise, the truncal involvement is not seen in the limited type. If we talk about the symptoms of limited type of systemic sclerosis, then we can remember the mnemonic CREST. So, what is CREST? CREST is basically CREST, where C stands for calcinosis, R stands for the Raynaud's phenomena, E stands for esophageal dysfunction, S stands for sclerodactyly, and T stands for telangiectasia. So, this is CREST syndrome, which are the symptoms of the limited type. As we can see that there is not much of systemic involvement in the limited type of systemic sclerosis. More of cutaneous changes are there, and there is not much of systemic involvement. But yes, late onset pulmonary hypertension can be seen. If we talk about the autoantibodies, anti-centromere antibodies are positive in the limited type of systemic sclerosis. Now, coming to the diffuse type, the interval between the onset of the Raynaud's phenomena and cutaneous changes is less. It's less than 1 year. And there is both truncal as well as peripheral skin involvement, unlike the limited type, which has only the peripheral skin involvement. Tendon friction rufts can be present. Systemic involvement is seen, and it can be seen in the form of the pulmonary fibrosis, renal failure, GIT problems, myocardial involvement. If we talk about the autoantibodies, anti-topoisomerase antibody or SCL70 antibodies are positive in the diffuse type of systemic sclerosis, while the anti-centromere antibodies are negative in patients of diffuse type of systemic sclerosis. Now, if we just summarize whatever we discussed right now, talking about the interval between the onset of the Raynaud's phenomena and the skin changes, it is a short interval, less than 1 year in the diffuse type, long interval in the limited type. Both truncal and the peripheral skin involvement is seen in the diffuse type, while only the peripheral skin involvement is seen in the limited type. Tendon friction rubs is seen in the diffuse type, it is not seen in the limited type. More systemic involvement is seen in the diffuse type, and it can be seen in the form of the pulmonary fibrosis, GIT, renal, or myocardial involvement, while systemic involvement is not a feature of the limited type. But yes, late onset pulmonary hypertension can be seen in patients of limited systemic sclerosis. And if we talk about the autoantibodies, anti-topoisomerase antibody or the SCL70 antibodies are positive in the diffuse type, while anti-centromere antibodies are positive in the limited type of systemic sclerosis. That's it. Thank you for watching this video.